Hello everyone, usual suspect here, Valdo Aginga, trained medic with Rescue Pal, and I'm here to take you on one of the leading causes of death in our country and in the world. It's a very interesting medical condition called the stroke. So what can we define a stroke as? A stroke is also called a brain attack. This is a medical condition whereby blood flow to the brain is disrupted, either due to a ruptured blood vessel, which causes bleeding into the brain, or a blood clot inside the brain. So, recognition features. How do we realize that someone is going to or is having a stroke? The first thing we will see is facial weakness. The next thing we will see is weakness of the arms. The next thing we will see is weakness of speech problems. And then also the casualty may have sudden confusion, also may complain of a sudden severe headache most of the times. And also you may find in some cases that the casualty may fall down and also feel dizziness, which may also lead to the casualty falling down. So how do we deal with this situation? Now, first, our main aims as the medic here should be to reassure and comfort the casualty, and the next thing should be to arrange immediate evacuation to hospital. Next, we have how do we deal with a casualty with a stroke. So we have an acronym, FAST, FAST. The F stands for facial weakness. You will tell your casualty to make a smile, and you will notice that your casualty will not be able to smile fully. So the F is for facial weakness. You will notice that one side of the face is weak as you speak to the casualty. Next thing, arm weakness. You will talk to your casualty and ask them to lift both arms. The casualty will have problems with lifting one of their arms. This may indicate that the casualty has a stroke. S, speech problems. You will ask your casualty to say something and you will communicate with them, and communication with them will be very hard. T here means it's time to call an ambulance. So after realizing all the three things in FAS, T means it is time to call an ambulance. So you will call your local ambulance dealer, and they will be able to reach there as fast as possible to manage the casualty who is having the stroke. Now, as the ambulance is on its way, you're supposed to make sure that you keep the casualty in a well-supported position. You can also tell your casualty to lie down if they are able to, and then also keep monitoring and recording the vital signs before help arrives. Vital signs: breathing, pulse, circulation. So that's it for today's episode on how to deal with a casualty who is having a stroke. Keep liking, subscribing, and sharing the videos, and we'll see you guys next time.